on Instagram. I'm hoping everything is okay. Hoping everyone is okay. And I've got a few questions here, which is very interesting. If you do have any questions, if you are looking for answers from a consultant plastic surgeon, then you're in the right place. Instagram is live. Hello, Instagram. So please feel free to ask me anything, and I will have a bash at answering, do my best to answer. What's that? What does that thing do on Instagram? It just does the brightness, does it? Like that one. Oh, God, that is not a good look. Oh, dear, oh, dear, oh, dear. I can't do it all. Can I do it all like this? The whole like this? Shall I do it all like that? No, that's not a good look. What about this one? Oh, this is good. Facebook used to have this, didn't it? The filters. What's that? Is that just flickery? Right, anyway, we'll get off the filters in a minute. Just do that one for the final one. Oh, nice. Okay, sorry. Let's just get off the filters. Yeah, so if you have any questions, then please feel free to chip in and ask away. Yeah, so it is. Oh, look at that. Facebook's working. Khan and Jackie are here. Good. That's good to hear. I mean, not that I doubt that everything's working, because obviously I know what I'm doing. I think, is Instagram, well, I don't know if I'm on Instagram. Do I have to press the button, or I have to just press the button? Anyway, God, you'd think I know what I'm doing by now. So, yeah. Instagram keeps on saying checking connection. I'm going to be professional. I'm going to go on. I'm going to crack on with this question here. Actually, I need Instagram. There's a photo. And I've got, anyway. Why is my keloid scar not suitable for excision? Is there anything else you could offer for the stinging and itchiness? So, keloid scars are really difficult to treat. And the reason they're really difficult to treat is because they're an abnormal type of scarring that your body has caused, if you like. So it's usually from quite an innocuous injury, an innocuous scar, that then creates a big lumpy scar. So it's your body's reaction to the scarring. And we don't really know what causes keloid scars. Hello, Instagram. I think it's on. I think Instagram Live is working. Am I right in saying that? Is Instagram Live working? I mean, the video's on and it says 19 active followers, but normally there's a place that says anyway. Live. I don't know if it is working, actually. Checking connection. Anyway, you know, hey ho, Facebook started with Facebook, didn't we? So yes, keloid scars are difficult to treat because it is the body's reaction, if you like, to the scarring. So a lot of people think, oh, just cut out the keloid scar and make it look better. If you cut out a keloid scar and stitch it up, yes, initially it will look better, but the risk is it will go keloid again. That is the problem. So we avoid cutting them out, really, if we can. There are certain causes for keloid scars. There's a keloid and hypertrophic scar. They're sort of two things which are on the same spectrum. A keloid scar is a worse version of a hypertrophic scar, but it's the same sort of spectrum. And if there might be a reason for your keloid or hypertrophic scar. So if you've had delayed healing, if it's taken a long time to heal, that might predispose to a hypertrophic scar. So, your connection isn't strong enough, it says there. That's why Instagram's not working. I mean, how terrible is that? Your connection isn't strong enough. What are you talking about, man? What's wrong with my connection? Settings. Yeah, I'm on the Wi-Fi. Good God. What's the world coming to? There you go. So if barring away now, if you have a reason for your sort of raised they're raised, unsightly, lumpy scars. So if there's a reason, so if you had delayed healing or an infection or something like that, then we might be more likely to revise it, because we might think, hold on a minute, if I revise it and you don't get an infection, then maybe you will scar nicely. But if you've had no reason for the keloid, so if you've just had there's certain areas where they're very common, the earlobe is very common, the shoulders are common, and also the sternum is very common, as in this case. And if you don't have any reason for the keloid and it's just come, then the likelihood is your body's reaction. And therefore, have I got too many things open? And therefore, if it's your body's reaction to it, then we'd be more likely to think, hold on a minute, I don't really want to give you another scar, because by definition, a keloid scar is bigger than the original scar or the original injury. You get a ear piercing, pinprick, and you get a great big sort of marble from that. So by definition, the keloid is bigger than the original scar. If we then cut that out, we'll give you a scar that was bigger than the original scar, which if that goes keloid, it'll go even bigger than your last keloid. So that is why we don't want to cut keloids out. We've got a photo here, so that's the photo. I think this is a side view, and I think it is it's a pre-sternal keloids, which is a very common place for them. And I personally would be very wary / would not really want to cut that out because I think there's a very high chance that I'll come back keloid, and I think there's a very high chance that it'll come back worse, because it is your body's reaction to the scarring. And therefore my advice would be to try steroid injections and silicone gel, which comes either as a gel that you apply or a gel sheet. Those would be my advice. And steroid injections can help with the itchiness and the discomfort, and can help with the raised nature of it, the red nature of it. I mean, you're always going to have a big wide scar there, but if we can make it slightly less raised, slightly more comfortable, that's the sort of thing I'd be looking for. And that keloid scar, I wouldn't be advising excision. Sometimes we do excision of keloid scars, but that's quite a nasty one over the sternum, and I think there's a high chance that will come back. And I think we are live on Instagram. We're working on Instagram, and do you know what's really annoying? That it's late on Instagram, and I have a way of showing the photos on Instagram. Look, there's the photo of the keloid scar, which I've just been talking about on Facebook, and I can show it on Instagram. It's a keloid scar on the chest here, and the question is, why is this not suitable for excision? And the reason is that the risk of doing excision of a keloid scar like that is that it can come back bigger. So the symptoms are itchiness and stinging, and so steroid injections can help with that. And so I would be looking at potentially doing steroid injections for that, and also silicone sheets and silicone gel might help, but I would not be looking at excision on that one personally, because I'll be very worried it comes back. When we do excision, and sometimes we do, certainly on the earlobe, when people have keloids, and certain keloids we do excision on. When we do excision, we tend to do what's called an intralesional excision, which means keeping within the realms of the keloid. So all our cuts are within keloid, and then we stitch keloid to keloid, so you end up with a rim of keloid left behind. So it's like a smaller keloid than you had to start off with, and then we do steroid injections to try and get rid of the last bit. So that would be my advice for that one, steroid injections. Oh, hold on a minute. Sophie's got a question. Nice one, Sophie. Good evening. Mummy makeover with lift, small implant and lipo to outer thighs and back. What is recommended recovery time, and what is pain level post-op and pain relief given? Not messing about, Sophie. Lift, small implant, lipo to outer thighs and back. Blimey. Well, I guess out of that, the main thing, the lipo is going to make you feel battered and bruised and knocked about a bit, but it's the lift and implant, I guess, is going to be the sort of main thing that's going to be in terms of recovery. So a lift with implants is quite a big deal, and I always say to people, lift with small implant, is it worth doing the implant? Anyway, no, probably not going to go there. Not that, maybe that's not the realms of the question, but yeah. So lift with implants is a big deal, and it does have a significant recovery associated with it. The first week, you're not going to feel like doing anything. You'll be all taped up. You'll feel tight, and you certainly wouldn't want to do anything. Second week, you'll be feeling better. You'll be doing stuff from home, which is what most of us are doing most of the time, isn't it? Doing stuff from home. So you might be all right doing bits and bobs from home. But I normally say after 2 weeks, you can get back to work if you're sort of working full time, or if you are driving anywhere, 2 weeks for driving, and 4 to 6 weeks really for doing anything too heavy, because you don't want to put any tension on the incision and on the wounds, because it is quite tight. So I think it would be the breast that would be the main thing. Haley says, when, Haley? How are you doing, Haley? Good to see you again. Hope you're all right. And when? Good question, Haley. I don't know when. No one knows. Does anyone know when? Anyone? No, not so sure. Another one with a photo, and Instagram, you're in for a treat, because I've got this photo as well. I've been told, I'm so glad that Instagram's on. I've been told that I would need 2 to 3 sessions to remove my birthmark fully removed. Can you please explain why this would take multiple sessions? Also, why does each session need 3 months apart? So we can show that on Instagram as well. So this is the birthmark here. So it's a birthmark on the scalp. 2 to 3 sessions. Yeah, I'd agree with that, actually, 2 to 3 sessions. I certainly don't think it would come out in one session. The problem is it's too big to come out in one session. It's too wide to come out in one session. That's not going to come out. So the reason that it needs multiple sessions is because if you cut that out in one go, if you cut all of that birthmark out in one go, that is not going to close. The skin on the scalp is quite tight. And so if it doesn't close, then you're looking at skin grafts and things like that, which look unsightly. So what we tend to do for big moles or birthmarks or tattoos also is a technique known as serial excision. And what that involves is actually removing as much as you can. So not removing all of it, removing as much as you can, and then stitching it up. And what that involves, what that leaves you with is a scar and a bit of birthmark left on either side. And then that stitched up feels really tight, it's really uncomfortable. But then as the weeks and months go on, it becomes less tight. Your skin, if you put it under tension, it then tends to relax. It's a function or an attribute of the skin. If you put it under tension, it relaxes over time. That's why you can get pregnant and have a baby. If you tried to put a full-term baby in a woman's abdomen, it just would never happen. But because it gradually grows over 9 months, that goes under a bit of stretch, and then a little bit of stretch, and then as that feels tight to start off with, and then the skin relaxes, and then you can put it under more stretch. So it's sort of the reverse way we put it under tension, by cutting a big bit of the, as much of the skin out as we can, and then we normally leave it 2 to 3 months, really. Probably 3 months would be better. To be honest, the longer you leave it, the better, because the skin relaxes as time goes on. And then 3 months down the line, when you first have it done, it's really tight. And then 3 months later, it's not tight anymore. And then you can cut another bit out. So it's called a serial excision. So that's why it needs to be 3 months apart. When you first do it, it's really tight. There's no way you can cut and take any more out. But 3 months later, the skin will have relaxed and you'll be able to take another bit out. So I would say, 2 to 3 goes on that one. And it would leave a scar, which would be a bit unsightly, because you can see where the hairline is. So the scar is going to come forward from the hairline, and not a great place for a scar, unfortunately. And because it's tight, the tighter you close it, the more risk the scar will stretch, and might look similar to what the birthmark looks like, to be honest with you. But that's a tricky one. Got to be honest, a tricky one. But that is the reason why it would need 2 to 3 sessions, and it would need to be 3 months apart. So nice. Showing the photos on Instagram. That's good. That's very happy with that photo showing session. Oh, hold on a minute. Sophie said something on Facebook. Thank you. Very helpful. What about a garment post-op? Sophie, that's Haley's photo? But anyway, never mind. We'll rise above it. Thank you. Very helpful. What about garment post-op? How long does it need to be worn for? So really, rather than a garment, there's garment for the lipo you're talking about. Okay, so for the breast, it's really a bra where you have tapes on for the first week, and then a bra, which is sort of like the garment. But yes, for lipo, what are we looking at? Outer thighs and back. To be honest, so it depends on your surgeon, Sophie. For thighs, I tend not to use a garment. They can be a bit uncomfortable, or it depends on how much liposuction, I guess, but they can be a bit uncomfortable when you get into thighs. You have to sort of go above and below, so they have to go up to your waist and down to your knees. So they can be quite big and uncomfortable. And where they stop, you can, in the groins and things, you can get a bit of swelling where there isn't compression. So we'd have to see whether you'd have a garment at all. But if you were going to have a garment, the garment is worn for a month. And then see how you go. You might want to wear it for longer because you might want to be supported, or might be beautiful sunny weather and you might say, for goodness sake, get this garment off me, in which case fine, you can see how you go after a month and start to sort of not wear it, but you certainly might feel like you need to wear it for longer and you can if you want. Actually, Sophie, you also asked what's the pain relief given. Usually pain relief for most operations for me is paracetamol and ibuprofen. I like keep it simple, stuff you got in your cupboard. If you do need more, we can give you the codeine-based painkillers like codeine phosphate and cocodamol, coproximol, that sort of thing. But they can cause constipation and they can cause dizziness. They can cause nausea. So they can cause some symptoms. So if you're not in pain, I always say, look, don't take them. But obviously, if you are in pain, then you might need the stronger painkillers. But hopefully, you will be all right with the sort of paracetamol, ibuprofen. Mummy makeover, yeah, mummy makeover, big op. Sophie, big op. Natalie Richardson Hughes, straight in, hashtag ask JJ. Okay, so Natalie instantly has shown us she knows what she's doing. She knows what she's on about. She's seen it before. She's watched the show before, and she knows what is going on around here. Hashtag ask JJ. Okay, yeah, that's what I'm talking about. Natalie, big respect to you. If I could like you, I would, but I can't on this thing because I'm not on actual real Facebook. I'm on a sort of thing that allows me to put the questions up, but it's not. It's like linked to Facebook, you know, and YouTube. By the way, we are live on YouTube, everyone. Yeah, I think. Well, we might not be actually because it said it wasn't linked properly. But anyway, in principle, we are. Maybe not in reality. But in principle, we're live on YouTube. Anyway, what's the Ask JJ, hashtag Ask JJ question? Well, I'll tell you what it is. I'm glad you asked me. Can a TT, tummy tuck, fully repair diastasis recti, 18 months postpartum, twin pregnancy, and still look 5 months pregnant? Tricky. Usually, Natalie, I mean, I don't want to say always, but usually, yes, you can usually repair most diastasis recti. For those of us who don't know, I say us, I'm not one of them, but for those of you who might not know what diastasis recti is, it's the muscles of your abdomen, of your anterior abdominal wall, of the front of your abdomen, on either side of your belly button. There's two muscles that go straight down. They're called the recti muscles. Rectus abdominis muscle, and there's two of them, and they go straight down, and they've got these lines, these what's called tendinous intersections along them, which give you your six-pack look, but they're actually going straight down. They're not going that way, they're going that way. And when you get pregnant or when you have large, put on a lot of weight, they can become separated slightly. And that's called diastasis recti. So the recti muscles can be separated, and you can check this by, if you want, in fact, it's probably best not to check it because it's best not to know. But if you do want to check it, you can actually lie flat on your back and either do straight leg raise or lift your head and shoulders up off the bed and feel above your belly button and feel if there's a gap there. And sometimes you can see a bulge there, and that is the separation between those recti muscles. And when you do a tummy tuck, at least a full tummy tuck, you can, we call it repairing those muscles. You're not really repairing the muscles, you just bring them together, but you can bring them together. And I have had some quite significant diastasis recti, Natalie, which I have managed to repair during a tummy tuck. So I would say that you can repair quite a significant diastasis recti. It's difficult to say without examining you, because I might think, oh my lord, this is a really bad diastasis, and you might not be able to repair it, But if your weight is good, if you're not overweight, if your weight is good, then it will certainly be able to be improved and hopefully be able to be fully repaired at the time of a tummy tuck. Thank you. Really helpful. This from Sophie. Thank you, Sophie. Hi there. Is it essential for me to stay overnight to have capsulectomy and the replacements put implants put in? Good one, Kelly. Good one. Maybe not. The problem is the capsulectomy bit, Kelly. That's the problem, because when you do a capsulectomy, you're removing all that scar tissue around the implant, and that can make it bleed. And when it bleeds, then you want to use a drain. So if you were done first thing in the morning, so personally, I'd probably use a drain if we're going to go for a full capsulectomy. I would use a drain. I do use a drain for a full capsulectomy. So if you're having a full capsulectomy, then I would use a drain. If you were going down in the morning to theatre, then it might be possible to have a look at the drain later on in the evening, and you might possibly be able to go home that evening if you really wanted to. The problem is, Kelly, I wouldn't be able to guarantee it. So I think I'd have to say to you, you might have to stay overnight, so it's tricky. If you want a guarantee, I think that would be tricky, Kelly, because I don't like sending people home with drains. So yeah, it's tricky, but it's a possible if we did it first thing in the morning, but I couldn't guarantee that. Brogan has just said #AskJJ, and then just an emoji. I'll take the Ask JJs, any way I can. So if you want to just randomly put #AskJJ, we need to get this trending, people. Okay, we need to get this trending, whatever that means. So, question: what's a bit different between teardrop and round implants? How do I answer that one? Well, to be absolutely brutal, not as much as I think some people think. And actually, some people don't think there's any difference at all. Some people will just use round implants because they say when round implants are in the body, they go a bit teardroppy shape. Some plastic surgeons say that there's no point in using teardrop. I do use teardrop, and I do think there is a room for teardrop, particularly in someone who's got very little breast tissue. Teardrop does have less fullness in the upper pole, and they are fuller in the lower pole than the upper pole, and give a more natural result, particularly if you've got no breast tissue. For instance, when we're doing breast reconstruction in people who've had cancer, we pretty much always use teardrop implants because the shape of the implant is dictating the shape of the breast. So if there's really not much breast tissue at all, I would tend to use teardrop implants. But having said that, some people may have a bit of breast tissue and might be sitting a bit low. And if that's the case, then actually a round implant can give you a natural result. So it's not strictly, some people, if you think teardrop implants are natural, round or fake, it's not as straightforward as that. You can get a natural result with a round implant, particularly if you've got a bit of breast tissue and it's sitting a bit low in your breast. Then a round implant can restore that and can give a natural result. So it depends on the profile of the implant. So the implants all come as different profiles: low, medium, high, extra high profiles. So you have to look at the profile of the implant, and you have to look at the breast tissue that you got before you start, because you've got to add the two together. But broadly speaking, a round implant is fuller in the upper part than a teardrop implant. But as I say, you get different profiles. So you get low profile, extra high. So there is quite a bit of difference between a teardrop and an extra high profile round. An extra than a teardrop, but a low profile round, approaching a teardrop. So it's not as cut and dried as you think. It's not like, oh, teardrop. Depends on the profile, depends on the breast tissue you've got, and yeah. So that the other thing is to bear in mind, if you are going teardrop, you've got to think the teardrop can rotate. So that's another thing to bear in mind if you're having a teardrop. But yeah, that's the difference. More fullness. Brogan, there was a question too. Aha. Or what is it, Brogan? Hit me with it. Have I missed it? Hit me. Hit me with a question. Kelly, is it essential we've done that? Hashtag ask JJ. Thank you. Ask JJ, thank you. Are overnight stays available at the moment? If not, when would you be able to complete a capsicum with overnight stay? They are available, Kelly. Yes, we do. We are doing overnight stays. Yeah, you can have an overnight stay at the moment, Kelly. So they are available. So yeah, now and do overnight stays. Who knew? Natalie, thank you very much. Well, thank you, Natalie, for starting the Ask JJ Tsunami. We've had 2 since you did that hashtag. One on Facebook and one on Instagram. I mean, don't know if I'm coming or going, all these Ask JJs. Right. What we got? Do you use saline implants? How do I answer that? No. Well, I suppose the easy answer is no. Would I use saline implants? Yes. If someone wanted saline implants, I would use them. But not many people in this country do use them. I think they use them more in America. Well, I know they use them more in America than we do because for a long time silicone implants were banned in America, so they had to use saline implants. So they got quite a large experience using saline implants. They are able to use silicone implants now in America, so they do use silicone and saline. But in this country, silicone was never banned, and so we've always used silicone. And I think there's a lot to be said for silicone implants compared with saline implants personally. But if someone had a strong view, we could definitely talk about it. But if you want someone who has got a wide experience of saline implants, I'm not your man. Unfortunately, I mainly / exclusively use silicone implants, at least silicone gel, different shells. So you have a smooth shell, a textured shell, or a polyurethane foam shell, but whatever shell you have, the inside of the implant is silicone gel. The other thing about saline implants is a lot of people say, I don't want any silicone in my body. In a saline implant, the shell is still silicone. So you have to have some silicone in your body because the shell is silicone. But admittedly, it's less because you don't have the silicone gel. Brogan, I did post it. I had a mastopexy with implants with Mr. Khan around 3 weeks ago. When is it acceptable to start exercising again? Can it be sooner than 6 weeks? Lots of conflicting information online. Well, my view, Brogan, on that one is I say lower body stuff after about 2 weeks. So if you're 3 weeks, this is all depending on how you feel, Brogan. So if you're feeling good, if you're feeling okay, start doing gentle lower body stuff. What that means is walking, not running, because that's impact. So walking, treadmill, again, walking on the treadmill or walking in the street. The stepper, the stepper, what's it called? Cross trainer, I believe it's called, but not the arms, just the legs. The bike, exercise bike, not going crazy on it, but just starting doing a bit of lower body stuff. You can do lower body stuff around 2 weeks. So around now, if you're 3 weeks, if you're feeling okay and it's all healed up nicely. And then it's usually 6 weeks for upper body and hot and sweaty and running and all that sort of stuff. So yeah, you can start doing stuff, but keep it lower body, keep it low impact. Don't get too hot and sweaty. Just gently ease into it. And if things hurt and swell, back off. And then even at the 6 weeks, when you start doing the upper body stuff, if it hurts and swells, back off. That's my advice. Yeah, there is a lot of confidence. That's why you should call us. Call us, and if you're worried, then Vicky can help, and Vicky can talk to Kurum, and get in touch. It's always best to talk to your surgeon with those sorts of things because everyone's different, which means that there's no right or wrong, to be honest, whenever everyone's different. So, hi, just wondering what the difference is between having under muscle implants and over muscle. The difference is, Tori, this is on Instagram, people. The difference between under and over the muscle is that if you have them on top of the muscle, and the muscle being your pec, so your pec major muscle, like that, it doesn't hurt as much, doesn't bleed as much, and the implant sits with the breast, and so that is good. And when you put them underneath the muscle, it hurts more, bleeds more, and sometimes the muscle can hold the implant high, Sometimes the muscle can hold the implant wide, and sometimes you can get animation deformities, which means when you do the gym and move, your breast moves because your implant's underneath your muscle. So that sounds like it's bad under the muscle. Why would it have under the muscle? The reason people have it under the muscle is because if you're very slim here, particularly if you can see your ribs, you worry you'd be able to see the edge of your implant. So when you put it under the muscle, it gives an extra layer of cover here to sort of hide the implant, if you like. So it's much more likely to hide the implant when they're under the muscle. So in terms of rippling, in terms of seeing the edges, feeling the edges, it's much less likely when you put them under the muscle. So that's the good thing about putting them under the muscle. The bad thing is hurts more, bleeds more, recovery slower, implants can sit high, wide, and animation deformities. Pros and cons, a lot of this implant stuff, good and bad. It's no like, oh, it's better. Anyone who says it's better to have them under the muscle or it's better to have them over the muscle, you've got to think, well, hold on a minute. What, why we just do it that way? We wouldn't do it, So pros and cons, Tori, pros and cons. Weighing up and picking what's right for you. That's the main thing. Brogan, amazing. Thank you. Yep, feeling pretty much back to normal already. Had amazing experience with you guys. Thank you. Thank you. Good. Well, yeah, then get into a bit of exercise, getting a bit of lower body stuff, as I say, exercise bike and the stepper thing. Kim, hashtag ask JJ. Look at that. Kicking off in the chat. I've got what looks like 2 blood blisters on the side of my breast. I've had them over a year. Could it be something to worry about? Blood blisters doesn't sound like it's something to worry about, Kim. If you've got like bruising, I'm thinking, have you got a clotting problem? If they're like bruising for over a year, it doesn't sound like it's anything to worry about the breast. I mean, obviously you worry about breast, but it sounds like that's probably more of a skin thing. If it's a blood blister, it's more of a skin issue. But I think it's probably worth seeing your GP, I would say. Maybe when we're able to see GPs. I don't know if we're able to see GPs at the moment, but yeah, if you had something for over a year, I think you should probably get it checked out. But it doesn't sound like, I'm not thinking alarm bells, crikey, get that checked out tomorrow. It just, I wouldn't be too really small and close to a mole. Yeah, it may be nothing. Kim, it might just be like, sometimes people get blood blisters on their face and things like that. Cat is here. Hi, Cat. Hope you're all right. Cat's got them, tiny red blisters. There you go. Cat's got them too. There you go. Hope you're all right, Cat. Megan's here. Okay, thank you. Good. What we got here? Faye Forsyth. I'm 4 weeks PO post-op of undermuscle HP textured implants. Look at that. Hey, Cat. I'm 4 weeks post-op of undermuscle high-profile textured implants. And one of my breasts falls lower and is bigger and also a different shape. I had the same size implants put in each side. Should I be panicking? Something is wrong with one of them. I wouldn't be panicking, Faye. I think this is what it's all about. You've got to, dear Cat, you've got to work with your surgeon, for these things. And certainly at this sort of time, the 4 week post-op period, you've got to work with your surgeon and they'll know what they did and they'll be able to advise you. But generally speaking, I normally say things start to settle around 3 months. So when people say to me, I'm a bit worried, one's bigger, one's higher, one's, whatever, different shape. If they say that at 4 weeks, I'm like, okay, well, let's have a look. And, that's okay. Well, it's always hard to say, don't worry, it's going to be fine. Because obviously we're all hoping that's the case and we're all, planning on that being the case. But you can never guarantee it. But what I normally say to people, look, at 4 weeks, you haven't got your final result. You're going to have a different result at 3 months. And hopefully that will be a better result and you'll be fine and the swelling and et cetera, et cetera. If you have the same size implants and your breasts were the same size before, generally speaking, they should end up about the same size. And if one's bigger than the other, it's probably you've got swelling on one side. So, it says currently broadcasting to Facebook is not available. Our engineer, well, am I broadcasting to Facebook? Okay. Our engineers are looking into it. This is a problem with using a program, isn't it? Because I'm not using Facebook. Anyway, I'm gonna plow on because that's what the pros do. So yes, I think you should be talking to your surgeon, Faye, and keeping close with them. But just in general terms, at 4 weeks, I won't be desperately worried, and I would just, hopefully things will settle over time, and give it a few months. Okay, so now we've got Kelly. Kelly, mine are currently under the muscle, and like I said, I have capsular contracture. Could my implants be placed over the muscle, or would you want to keep them under as pocket is already there? Hashtag ask JJ. Good question. That is a good question, guys. I mean, they've all been good questions, but that is a good one. Because Kelly, the thing that I know what you're saying. The thing that would worry me is I would be thinking, hold on a minute, why did they put them under the muscle? Unless you put on weight and you got more cover now than you did then, I'd be worried that they put them under the muscle first time round because they're worried that you could see them or feel them. And so to put them on top of the muscle now might make you think that you're going to see or feel them. So that's the thing that would worry me. It's possible. I mean, there's no question about it. You can change plane. It's easier not to. It's easier to keep them in the same plane, but it's completely possible to put them from under the muscle to over the muscle, or from over the muscle to the other muscle, to change the implant plane when you change the implants. But I would just be a little bit worried about changing from under to over the muscle, unless you say, actually, I put on a lot of weight before and since the surgery, and I was very slim then, and that's why they put them under the muscle. But I've got more coverage over my chest and more soft tissue cover that now. Then, then that might be a reasonable thing to do. But good question. Something we really need to discuss in clinic and examine you, etc. Faye, thank you for the reassurance. Really appreciate it. Good luck, Faye, and yeah, hopefully things will be just fine. Give it a few months. Kelly, I was a size 8 when I had them done 16 years ago. I'm now a size 14. So there you go. So maybe you might be all right changing plane. So it might be a go. Okay, might be a go. Right. Becky has asked to be in my live video. I think that's usually a mistake when people do that. If I say yes, Becky, you'll just appear split screen with me, which can be a bit disconcerting because all the viewers will see you in your living room, like on Saturday night takeaway. So not sure if that's what you're asking, but if you are, then fine. But he's gone. No, she retracted the request. I think I have capsular contracture. Look at that. How long can I wait until I need to seriously consider surgery? As long as you want. There is no time limit at all. In fact, the longer the better, to be honest with you. And if someone comes with an early capsular contracture, especially if they've only had the implants in, a few years, then I would say, leave them as long as you can. Because the problem is, capsular contracture is scar tissue forming around the implant. If we change the implants, we do a capsulectomy, take all of that capsule out, put a new implants in, that's a traumatic operation. It's more traumatic than the first operation because you're cutting all that capsule out. And so when you cut all that capsule out, then that creates more scar tissue. So another capsule comes quicker second time around. So you don't want to start the clock ticking on those second set of implants, any sooner than you have to. So if you can leave it another few years, then fine. And it's not going to be the case that you're going to come and we're going to say, oh, crikey, if you'd come a few years ago, it would have been so much easier, or, it would have been so much better. The longer you leave it, the better. So that's the answer. If you can leave it, sometimes people have 20 years, 25 years, brilliant. If you like 5, 6, 7, 8 years, you're thinking, oh, it's quite soon. You don't want to have a surgery every 5, 6, 7, 8 years. So the longer the better. But if it gets uncomfortable, if you don't like it, if it's unsightly, then I understand you might want to have it done, which is fine, as long as you appreciate that it can come back. Does having breast implants alter skin or nipple sensation? If yes, for how long? Yes, it does. And it often a problem early on. It's rare for it to be a long-term problem, but it can be a long-term problem, as in a permanent problem. You can get funny feelings in your skin and in your nipple permanently, but it's not common. It's common for it to happen early on, and it's normally about 9 to 12 months, about a year for it to come back. So you don't know whether it's going to come back to life or not for about a year. So it does take a while for it to come back to life, but it's often a problem early on. So yeah, it's the answer to that. Do you have any idea when you'll be doing face-to-face consultations again? Tori, where you been? We're doing them now. It's happening. It is happening. So we're encouraging as much as we can virtually. So we're encouraging virtuals, but we are doing, I've got a clinic tomorrow and I'm seeing people in real life. So we are seeing people in real life in the clinic. So face-to-face consultations are happening. Surgery is happening. We're doing surgery in real life, so it is happening. All PPE'd and all that malarkey. We only have one patient in the clinic at a time, etc. So we are, doing limiting access, but there's no question we are doing face-to-face consultations at the moment. So get in touch and be happy to see you. Kat, can I ask, is the risk of ALCL the same with all implants? What are you asking that for, Kat? Anyway, no, Kat, it's not. So we don't really know what causes ALCL. But it seems so. ALCL is a type of cancer associated with implants. I don't know if everyone knows that, but it's a relatively recent thing, and it's very rare. And it seems to be related to the roughness of the implant. So the more rough the implant, the increased the risk of ALCL. So the smooth implants, the glassy smooth implants, which are the way they made them first back in the day, have got a lower risk of ALCL than the rough ones. So some surgeons are moving towards using the smooth ones because they've got a much lower risk of ALCL. The problem is they've got a higher risk of rippling, the higher risk of capsular contracture. So broadly speaking, you've got three types. You've got smooth, rough, and polyurethane, which is even more rough than a textured implant. So you've got smooth, textured, and polyurethane. And they get increasingly rough. So the polyurethane ones are very rough. The textured ones are a bit rough and the smooth ones are smooth. So the risk of ALCL is much higher in polyurethane than it is in the textured, and much higher in the textured than it is in the smooth. But the risk of rippling and capsular contracture is the other way around. It's higher in the smooth than in the polyurethane and the textured. So it's a balance. Like I said about the muscle thing, it's a balance. No right or wrong. That's why it's so tricky, all this stuff, Hard to know what to do, isn't it? Hard to know what to do for the best. Can I still get breast implants if I have a strong family history of breast cancer? Yes, you can. And we do breast implants in people with breast cancer. So when we do mastectomy, so remove the breast and reconstruct the breast, you can reconstruct the breast with implants. And if you can have implant in the other side. If you've always wanted your breast to be bigger, then you can reconstruct a bigger breast and augment the other side. So you can use implants in people who've got breast cancer, and it's absolutely fine to have breast implants if you have a history of breast cancer, and there's no problem with doing investigations, although you do have to tell them you've got implants in because they have to change the way they do the mammogram. They'd be a bit more careful about doing biopsies of any lumps and things like that. So you have to be aware, but it's absolutely fine to do breast implants if you have a strong history of breast cancer. No problem. Excuse me. Thank you. Bypass to titas. Hello, is mastitis post-BBA common? Is it unilateral or bilateral? No, Katie, it is not common, and it is something we were really worried about because any infection in the breast tissue could potentially get to the implant. So it was something that we would treat aggressively after a breast augmentation. If there's implants in there, any sign of infection in the breast is something we would treat aggressively, and it'd be very uncommon for it to be bilateral. It would usually be unilateral. So the problem is, what we say to people having breast implants is say, look, we're really worried about infection. So if it gets red, tender, swollen, painful, those are signs of infection, and you have to seek help. So you have your breast implants, and what happens? You think, oh my God, it's a bit red. Oh my God, it's swollen, it's tender, it's painful. I usually say, look, if both of them are like that, it's unlikely to be a bad thing, infection. It's just inflammation. It's just the fact you just had surgery. They're both quite tender, red and swollen. So it's very unlikely to get bilateral infection, bilateral mastitis or bilateral infection in the implants. So if it's bilateral, I'd be thinking, well, that's probably just inflammation, just probably swelling and discomfort from the surgery. It's usually unilateral. If they say it's red, hot and swollen and tender, and I say which one or both, say both of them equally, I'm like, okay. If they say one of them, they say, oh, my right one's really tender, hot and swollen, and my left one looks fine, I'm thinking alarm bells. That's something I'd be more worried that it'd be an infection. It is unilateral. What we got here? Kelly, back in the room. Kelly, you are top dog. Thanks for your help. I had a virtual consultation last year with yourself. Nice to see you. Then COVID hit. I would like to go ahead and book a face-to-face, so I'll contact your surgery tomorrow. You've been really helpful. #AskJJ. Kelly, Get in touch, girl. Get in touch, and I'll see you. Maybe not see you tomorrow, but book yourself in tomorrow, and I'll see you in real life. Absolutely, you're very welcome. Nice to see you. Um, how long is recovery for removal of implants? Is it the same as the breast augmentation I've had? No. If you're having removal of implants and not replacement, then it will be a lot quicker. Recovery will be a lot quicker because obviously when you put implants in, it's tight. The wound's under tension, the skin's under tension, everything feels tight, a bit uncomfortable. So removal of implants are much. Obviously, there's no tightness. The wound's not under any tension, so it's much more like to heal nicely. If you do get any problems with the wounds or anything like that, we're not as worried about infection and things because I'm presuming you're not having implants replaced. So yeah, it's a lot better if you're just having implants removed. In terms of you're welcome, Katie, Dr. Katie K. So it's much better if you're just having the implants removed. Is it possible for my body to reject the breast implants? No, not no, but a lot of people say it. And the reason a lot of people say it is because what happens is they get infection. So in medical terms, the term reject or rejection is for tissue, is for some tissue. If you put some tissue in the body which is not the host tissue, if you took a bit of tissue from someone else and implanted it in you, whether that be skin or a kidney or a whatever, your body, there are antibodies in your body that will attack that foreign tissue because there's antigens on the foreign tissue and they would destroy it and reject it. That's why you have to match donors and things like that when you're giving kidneys and things like that. That doesn't happen with a breast implant, and a breast implant doesn't have any antigens. The antibodies will not attack the breast implant, so it cannot get rejected in that sense. The body won't sort of attack it. But what sometimes happens with implants is that they get infected, and if they get infected, it gets red, angry, and swollen. And what can happen is the wound can open up, and sometimes the implant can look like it's coming out. And people say, I rejected the implant, my body rejected it, which I can understand why they're saying it, but from a medical term, it's not rejection, it's just infection and the wound opening up and the implant getting exposed. So it's not strictly speaking rejection. So it's not like if you had another implant, that would get rejected as well. You would hope that you'd have to have it out for a few months, but you'd hope if you had another implant, then you wouldn't get another infection. I mean, you could, but it'd be unlikely. You wouldn't hope that you wouldn't have another, it wouldn't, it doesn't reject in that way. Hey, Kelly, what was the answer to this as just joined? What was the answer to what, Kelly? Kelly's asking Kelly what the answer. What was the answer to what? Could the implants be placed over the muscle or under? You can change plane, Kelly. I think that was the answer to Kelly's question. You can change from under to over or over to under. What causes an implant to bottom out? That's worrying, Rosie. What are you asking these questions for? Goodness me. What causes an implant to bottom out? How successful are revisions to fix it? Well, an implant bottoms out usually if the pocket's too low or if the implant descends below the inframammary fold. So if the implant descends too low, then that's bottoming out. You're talking about an implant, yeah, because breasts can bottom out as well. When you do a breast reduction, they can bottom out. But basically, it's too much implant below the breast, below the fold. The implant sits, the nipple's high, or the nipple's usually not high, but it looks high because the implant's descended down. And then how successful are revisions to fix it? I've got to be honest with you, Rosie, it's not easy. Fixing bottoming out is not easy. You have to look at it and look for the cause and look what's going on. But if it is the fact that the implant's descended below the inframammary fold, you then have to reconstitute that inframammary fold. You have to use long-term dissolving sutures to to reconstitute that and to make that robust again. And excuse me. And yeah, I mean, there's a risk it doesn't work. I mean, how successful? I don't know. It's not a common operation, so I can't give you figures for how successful it is. But if someone was having a revision for bottoming out, you'd have to say, look, I'm really hoping to make this better. It might not be perfect. There might be issues, but I'm going to try and make it better. and there might be dents and things like that. And because from those sutures to reconstitute the inframammary fold, they're dissolvable sutures, but they take a long time to dissolve. So the dents can be there for a few months. And yeah, it's a tricky one, fixing bottoming out. I'll be honest with you, Rosie, it is a tricky one. What have we got here? Amy Perry's joined. Good to see you, Amy. Just in time for this question. What do I need to do to maintain the shape of my breasts after surgery? I'm worried my breasts will sag and fall off the implant over time. I'll tell you what you need to do. You need to not put on and lose weight and not have children. Because those are the two big things that will make your breasts sag, to be honest with you. If you're worried about your breasts sagging, don't have weight fluctuations and don't have children, because they both make the breast bigger and smaller, and that makes them sag. The other thing, look after your skin, be careful in the sun, not too much sun, drink plenty of water to try and keep the elasticity of the skin. But apart from that, I don't really advocate wearing bras all the time. Some people talk about wearing bras over day and night to stop the breast sagging. I'm not sure if there's evidence for that. The really big things I think you need to do is just to try and avoid significant weight changes, and also avoid getting pregnant. Well, obviously for this specifically, if you want to get pregnant, fine, but it does have an effect on your breasts. And the other thing is, the bigger your breasts, the more that they will be acted on by gravity over time. So the more likely they are to sag. And if you've got implants in, then the implants tend to sit there and the breast can sag. So that is something to consider. So yeah, don't have weight fluctuations, and don't get pregnant, and don't smoke. Can I still get mammograms with breast implants in place? Will it rupture my implant? Do I need to notify my GP? Yes, no, yes. So yes, you can still get mammograms. Will it rupture my implant? No. Do I notify my GP? Yes. So you need to tell your GP that you've got implants in place, because when they do the mammogram, they need to do it slightly different. They need to take it at a slight angle to image the breast. So you need to let them know you've got implants in, but they are well used to doing mammograms on people with implants, because quite a lot of people have got implants. So you will be fine, but you do need to let them know. I want breast surgery so I no longer have to wear a bra. Is this possible, or will my breast sag no matter what? Your breast will sag no matter what. So you may not need to wear a bra to start with, but yes, over time they will sag. What breast surgery does, particularly breast lifts, which I think is what we're talking about here, is it lifts your breast and it gives you a better shape, and it restores you to a better place. So it gets you to a better place that you used to be at. But you will age, and gravity and weight changes and all these things will continue to affect your body as time goes on from here. So it won't lock you in that place forever. And it won't be that you'll never have to have any more surgery because your breasts are locked because you spent thousands of pounds on them. Unfortunately, gravity works on us all, and it will continue to work on you. Now you'll be at a better place. So if you hadn't had surgery, gravity have worked on you from a worse place. So you will reset yourself to a better place, but it doesn't lock you in. And that's the same for anything. Same for tummy tucks, same for facelifts, same for any sort of skin tightening work. It resets you back to a better place, but it doesn't lock you there forever, unfortunately. So you breasts will continue to sag just like they would have done if you hadn't had surgery. When are breasts fully healed after augmentation? Depends what you mean, Nikki. I would say the skin should be healed within 5 to 7 days. So the skin's usually healed with 5 to 7 days. So usually you have a dressing for a week is sort of standard, I would say. And you don't normally need a dressing after that, because the layers of the skin are healed in that time. So you can normally wash and shower. Now, in terms of all the tissues inside, then that takes months. It takes a good couple of months for the skin to get its full strength. And also you have quite a lot of swelling, and the shape isn't quite right to start with. They're often quite full in the upper part of the breast, and they take time for that fullness to soften and settle. And I normally say that starts to settle, all that swelling or what have you, scars quite red, starts around 3 months and can take 6, 12, 18 months for it to really properly settle. So in terms of them feeling like your own, and no numbness and the shape, etc., maybe a year really, give or take. But in terms of sort of healing, a week. So you know, hope that's answered your question. Kim, hashtag ask JJ. That's what I'm talking about. If having just a lift, do you lose any breast tissue? No. You do lose a little bit of volume because you do take some skin. You're welcome, Nikki. You do take some skin, but not a significant amount of volume and certainly no breast tissue. If you have got big breasts and you just want to lift, sometimes we might say to you, look, you know, it might be worth taking some volume out of the lower pole to make them less heavy, to make them less droop over time. But if you haven't got big breasts, or if you want to keep as much volume, the size of your breasts as you know, as similar to what they are now, then you can just have skin removed, and then the breast is just molded and reshaped and brought up into a better place, and all the breast tissue is left. But some skin is removed, so some volume is removed, but it's not a significant amount of volume. I'm out of questions. Right. Thank you all. Good bit of hashtag ask JJs. Encourage that. I will. That's me. That is me. I will be here. Same time, same place, 7 o'clock next Tuesday. If you've got any questions, plastic surgery related, drop me an email or get onto Instagram or Facebook or YouTube. If this is on YouTube, I think it is. And I will be more than happy to answer it if I can. I will do my level best. So hashtag ask JJ. I'm going to check out and sign out. It is 8:05, so I should be getting just the beginning of the second Antiques Road trip. So go and look forward to that. 7 o'clock and 8 o'clock Antiques Road trip. I do love a bit of that. And so I will see you right here next Tuesday. And have a good week and keep your chin up. It's difficult. I'm saying it. It's difficult, isn't it? Keep your chin up. Is you know, is there light? I think maybe there's light there at the end of the tunnel. Cat, pick up yourself. Khan, thank you. Jackie, God, you guys still here. Jackie and Khan have been here the whole time. Tell me you've gone away and come back again. Come on. You haven't been here the whole time. Wow. That is dedication for you. Wow. Big up yourselves. Right, I'm going to check out of here and I will see you all back 7 o'clock Tuesday, whatever the date is next week. Are we into March yet? Might be into March, you know. Into March next week? That'll be something, won't it? All right, then. See you next week. Bye. Stop the stream.